Hello, my name is Carolina Schinke from the University of Arkansas, where I treat multiple myeloma patients. Another work we're presenting here at ASH was done within a clinical trial, the Talquetamab trial, which tested the Talquetamab, the GPRC5D bispecific antibody, which is now FDA approved in multiple myeloma patients. In fact, this trial led to the approval of Talquetamab in multiple myeloma patients who have had already at least 3 or 4 lines of treatment. In this particular work which I'm presenting, it's not so much on general outcomes. I think that has been already presented. We know that Talquetamab works very well, 70% overall response rate, prolonged, lengthy, 12 months progression-free and overall survival. But what we really are focusing on now is, are there differences in toxicity and efficacy in African American patients compared to Caucasians? Research now, which is actually looking at response rates between race, it has become really prominent because we've seen that there might be different effects depending, what your genetic background is. And for Talquetamab, it's particularly important because it attacks or it targets GPRC5D. GPRC5D is a long name. It's a protein, it's a target on the plasma cells, on myeloma cells, that the antibody, the bispecific antibody binds to, and then the immune cells come and destroy the myeloma cells. However, it's not solely expressed on plasma cells, it's also expressed on skin cells and on taste buds. And so, naturally, side effects from the drug are going to be related to the skin and the taste. So we see patients having skin rashes, itchiness, dryness, as well as what we call dysgeusia, so change in taste or dry mouth. And these are the most prominent side effects of Talquetamab. Why that might matter more in Black patients or in Black Americans is because their skin tends to have more layers, so it's thicker, so they have more of this protein expressed probably on the skin, maybe also in the taste buds. And so the question is there a difference in side effects? In this particular work, what we did is we looked at the clinical trial and looked at Black American patients and try to see, compared to the white patients, is there a difference? And it's overall, it's only a small proportion of patients who were Black Americans on the trial, roughly in phase 1 and 2, roughly only 10%. That accounts for 17 patients out of 100 and plus patients. So it's not a big population, and the results are not statistically relevant, so we couldn't really get good statistics just because it is a small population, but it gives us an idea a little bit of what happens. And what we saw is that Talquetamab, it works well, both in Caucasians as well as in African or Black American. There were no side effects in terms of hematologic toxicities, so cytopenias were similar, cytokine release syndrome was similar between Black and white Americans. But as we kind of thought, there were more skin-related toxicities as well as taste-related toxicities in Black Americans. It was reported in more than 90% Black Americans, whereas in Caucasian, it's still common, 70 to 80%, but maybe a little bit less. Whereas efficacy, we didn't really see a lot of difference. It works, again, both very well in Black and in white Americans. So it's something to keep in mind. The side effect profile is something to keep in mind when you go on to treat patients with these bispecific antibodies. So if, depending on what race they are, you might want to choose one over the other. So we have Talquetamab, which is the GPRC5D. We have other bispecific antibodies which target other proteins. And so maybe to prevent these side effects that are particularly seem to be more evident in Black Americans, maybe we can choose another bispecific antibody in these patients. I think that would maybe be a conclusion. However, again, the data is very early on. It's still quite premature. It was a very small patient population. There is a chance that maybe there are more side effects in Black Americans. Maybe it will also work better. So these are things we still need to elaborate on a little bit more. Right now, what we can say is it works very well in Black Americans, but there is the risk of developing these side effects, dysgeusia, so taste changes as well as skin rashes. But with that in mind, things work very well and treatment is advancing very rapidly for multiple myeloma patients. So it's exciting.